Hi everyone, it's Tammy Sharrow, and I'm going to be talking about preschool age children, specifically around child abuse and child maltreatment. Now, this can apply to children be outside the preschool range, but we focus this information here because child abuse and maltreatment is most common in the first 3 years of life. All right, so I want to talk a little bit about the Canadian Incidence Study. Prior to 1998, we really didn't have a lot of information about the incidence or prevalence of child maltreatment in Canada. And so a study was launched in 1998 and then repeated in 2003 and 2008. And in the link that you see on the screen, which you can also access on the straight PowerPoint slides, speaks to the most recent results. What's interesting is that from 1998 to 2003, there was a significant increase in the incidence in Canada, but that leveled out in 2008. So is it a true increase, or is it people just becoming more aware of child maltreatment, people feeling more comfortable reporting, children getting the help they need? So it's really hard to say, and the fact that it leveled out in 08 is great. In 2018, they repeated the study and they have yet to publish those results. So I'll be really interested to see once they're available. The Canadian Incidence Study definition of child maltreatment included 25 forms of maltreatment, subsumed under 5 categories. Physical abuse at 20% of the cases, sexual abuse at 3%, neglect 34%, emotional maltreatment 9%, and exposure to intimate partner violence 34%. So take a look at the link. There's some other really interesting information that kind of was revealed in that study. So why are we concerned about abuse? What are the issues surrounding abuse? There is some major significant consequences resulting from abuse. So we could look at physical consequences. Well, there certainly could be physical injury, but there can be issues resulting in emotional regulation, learning issues, issues with memory, motor skill and motor skill development, higher level or executive functioning, and often I have dropout here. I probably would put that under behavioral consequences, but often they drop out of school and fail to finish high school and don't go on to post-secondary. Psychological consequences, diminished executive functioning, cognitive skills can be poor mental and emotional health. Depression is common. They sometimes can have difficulties forming and maintaining relationships and attachments, and certainly can experience post-traumatic stress. Behavioral consequences, involvement in crime and juvenile delinquency is more common, as well as substance abuse, both alcohol and drugs. And lastly, generational consequences, where if a child was maltreated or abused, they are more likely to abuse their own children. So it's a learned behavior, and that is definitely the highest risk factor for parents. So different forms of abuse. Your textbook does a good job of looking at the 4 or 5 major types. Physical abuse, deliberate application of force to any part of the child's body, which results or may result in a non-accidental injury. And so when we look at different types of physical abuse, some of the common methods might be hitting a child, kicking, punching, pulling hair. Question about spanking. We're going to talk about spanking in a little bit. whipping, burns. We looked at burns last week, and 25 to 30% of child burns are as a result of child abuse. Uh, a physical force to the point of causing fractures. And Shaken Baby fits under this as well. So what's interesting about Shaken Baby is about a third of those kids might come into medical care, but there's never a proven case or a substantiated case, and those kids go back home. And those are the kids we're most worried about. There's infants that will come in with and will develop ongoing sequelae, blindness, deafness, cognitive damage, mental retardation, those types of things. And then about a third will die. And so we are very concerned about Shaken Baby as well. And in fact, probably most of you came from maternal newborn, and talking to parents about Shaken Baby is really one of our $1 million messages for new parents. So is spanking legal? So we actually have a spanking law in Canada. It is Section 43 of the Criminal Code, and spanking can mean different things to different people. It can also have different effects on different children. And so what constitutes a legal spank? Well, a legal spank says it must be where the parent or whomever is inflicting this is using reasonable corrective force. It is permissible under certain conditions. The force must be trifling and transitory in nature. So, very interesting definition. This spanking law came under huge criticism from the Canadian Medical Association and the United Nations maybe about a decade ago, but it still exists to this day. And we consider spanking illegal if it is done in a way that is degrading or harmful to the child, that there's the potential for bodily harm, and it is done because the parent is angry, frustrated, lost his temper. It's a form of discipline. And if I was in class, we often do a poll in the class to see who was spanked as a child, because believe it or not, spanking is alive and well, and most children experience some type of spanking. So other forms of abuse, sexual abuse and exploitation, although it ranks lowest on the Canadian incidence study, most people feel it's very underreported. It's not like physical abuse where you might see bruises, broken arms, loss of patches of hair, that sort of thing. It's often invisible. And so it is when it occurs when an adult or youth uses a child for sexual purposes. So what might that include? It could include fondling, touching, intercourse, sodomy, oral sex, and also pornography, or involving the child in the development or creation of pornography, prostitution. So about 10% of school children report being sexually abused at some point in their life, about 1 in 4 girls and 1 in 10 boys. And just remembering that the age of consent is 16, so anybody under 16 is where we typically see sexual abuse and exploitation occur. What's really interesting is that victims are really found in all classes, socioeconomic classes, and all races. Sexual abuse really increases distress to the child if the abuser is a family member, or the child lacks support from the non-abusive parent, or sometimes it can be a relative. There's significant long-term consequences, and bribery is a very common strategy used by the sexual abuser to lure the child. And children want to tell about it, but they often find it difficult to break the silence and tell. Sometimes, especially if it's a family member or a close relative, they're afraid that, they're going to lose their whole family structure, as vulnerable as they are. Looking next at neglect. So neglect occurs when a child's parents or caregivers do not provide the requisite attention to his or her emotional, psychological, or physical development. And so this is failure to provide for the most basic needs, such as clothing, shelter, food, very, very, very basic needs. And there can be a lot of short and long-term consequences with neglect. If we think back to the video we watched during Contemporary Child Health Issues, it talks about how brains are built and the impact of failure to have a strong bond or relationship with your primary caregiver, the impact of toxic stress, which a lot of these kids encounter. And neglect often isn't like in a silo, but it often overlaps with other forms of abuse. So a child who is neglected may, pardon me, also suffer physical abuse, for example. So I just wanted to share this graph or chart from the Canadian incident study because it looks at different forms of substantiated neglect. So these were cases where it was substantiated or proven, or there was enough evidence to say, yes, this is definitely neglect. And you can see the list of different types of neglect. So it could be very, very, very basic needs, as in physical neglect, but it also can be failure to supervise or protect. It could be medical neglect. So the child has a medical concern, issue, problem, and the parent doesn't seek medical attention or fails to follow through on proper treatment, permitting criminal behavior, abandonment, leaving the child unsupervised and without a parent caregiver, and educational neglect. So parents who fail to send their kids to school and aren't homeschooling them and that type of thing. So you can see it's quite broad, and you can see that the incidents, top incidents, is failure to supervise or protect physically and physical neglect. So moving on to other forms of abuse, emotional abuse. And emotional abuse involves acts or omissions by the parent or caregivers that could cause serious behavioral, cognitive, emotional, or mental disorders. So when we think about emotional abuse, what are some of the things that might be included in that? It could be things such as belittling the child, attacking their self-esteem, terroristic type of behavior on the parents' side. And another aspect that happens in relation to emotional abuse is the notion of failure to thrive. So sometimes when children are emotionally neglected, they can actually fail to grow. So there could be organic causes for failure to thrive, but this is a non-organic cause where the lack of that emotional connection literally affects the child's growth pattern. And I've seen that in infants admitted to hospital for failure to thrive, poor growth related to emotional maltreatment or just lack of an emotional connection. Infants that are left to lie in their crib for hours and hours and hours unattended. They don't get their needs met. There's no development of the trust or resiliency. And within emotional abuse, it was only in the 2008 study where they included the exposure to family violence as a type of emotional abuse. And it ranked right up there with physical abuse in the statistics as far as most common. So, now that's considered a type of emotional abuse, and, children may end up being apprehended from an environment where they're witnessing that on an ongoing basis. So, let's look at some of the root causes of child abuse. And the majority of parents, don't desire or intend to abuse or maltreat their children. There's the odd, sensational case you're going to hear about in the media where, the parents actually set out and intended to abuse their children, but that's rare. And so I like to share this model. It's an ecological model. It was first set out in 1979 by Germain, but it explores root causes of child abuse. And so let's begin. So there's certain risk factors in each one of these three areas that increase the risk or the incidence of, the risk of child maltreatment or abuse. And so some of the child or victim risk factors are if it was an unplanned pregnancy or a very complicated pregnancy, if the infant specifically has a difficult temperament, or even the child, toddlers or preschoolers with difficult temperaments. In the Canadian incidence study, some of the children that had the highest incidence actually had some behavioral disorders and had a higher rate of attention deficit disorder. So preterm infants, definitely we know there's a higher incidence of of maltreatment, and those babies are often higher needs babies. They can be fussy, more irritable, difficult to settle. Multiples, twins or triplets. Infant feeding problems, such as an infant that's colicky, an infant that cries a lot. Children with disabilities, much greater incidence in that category. And then in relation to sexual abuse, being female. Parental or caregiver risk factors include maternal age. So the younger the maternal age, the greater the risk factor. The lower the maternal education, the greater the risk factor. Single parents or parents that are very socially isolated, lacking social support. Low self-esteem in the parent or poor coping skills such as anger management. Definitely substance abuse, drug or alcohol abuse can really increase the risk. Poor parenting in the family of origin, as I previously mentioned, if the parent themselves was abused or neglected as a child. Parents who receive little enjoyment from parenting, they might have unrealistic expectations of the child that don't fit with the age and stage of growth and development. So my 4-year-old should be able to clean the house. And parents who view themselves as victims in life. Environmental risk factors. Economic disadvantagement, economic disadvantage and poverty is a major contributor to child abuse and neglect. Financial stress, unemployment. Interesting, single parent or step families, there's a greater incidence. Unrelated adult males or boyfriends living in the household. Marital conflict. This overlaps a little bit with parent risk factors, but certainly lack of social support. And just the high level of violence in our society today, domestic violence and general community violence. So when we take a family that has child risk factors coupled with parent risk factors and environmental, the chance for that child to be maltreated or abused is going to be much greater. So if we have a parent with mental health issues or substance abuse and a preterm infant and the family lives in poverty, you can see the play of those risk factors. So let's talk about nursing assessment when abuse is suspected. So as nurses, we often can be the first contact for many of these families. You might be working in a medical clinic where the parents bring a child in with an injury. You might be working in emergency where parents bring the child. You might be working in ICU where a shaken baby arrives. And so we need to be aware of some of the things that are, get our spidey senses going, that are red flags. So first off, and probably the most prevalent, is when the history of the injury, and I'm talking more physical abuse here, the history does not fit with the injury. So my child slipped in the bathtub and now, is unconscious due to a head injury, or my child fell off a chair and has a fractured arm, or my child trips and falls a lot but has bruises in places where kids normally don't get bruises. So the history doesn't fit with the injury. Any kind of suspicious or inappropriate responses of the caregiver. I can remember a shaken baby when I worked peds ICU get admitted. It was probably about 1 or 2 in the morning, and they came in to emerge, and the baby got admitted to peds ICU, and then the parents didn't seem concerned at all, and they ended up deciding to go home to get some sleep, which wasn't really an appropriate response when the child was very critically ill. Inappropriate response of the child. So you think about a child maybe that comes into emergency and has a fractured arm. You think about how they would be responding to their injury and to the parent or the caregiver. So there's some sort of inappropriate response between the child and the parent, or the child who's very compliant with painful procedures, or is sitting very quietly, who looks withdrawn, doesn't make eye contact, some of those things. Obviously, if the child discloses, that's a red flag, and we need to take action on that. And I'll talk about that a little bit in the few slides. Previous reports of abuse in the family. So sometimes these kids might show up and emerge. They might have repeated visits to emergency. They might have an old chart with history of previous injuries. So that kind of creates a pattern or a trend. And as I mentioned, history of abuse in the parent or caregiver. I remember a set of preemie twins that came into the peds ICU. One had shaken baby, and the other one was admitted solely because of the concern that it could happen to that baby as well. And the mother, in the chart, it had written that she was had a history of abuse as a child herself. Now she's got preterm infants. She's got twins. They're living in poverty. They don't have good coping skills. All of those things put together. So the other thing is we have to be aware of our assumptions, because certain things that might look like child abuse might not be. And so just because a child has multiple bruises doesn't necessarily mean they're being abused. But, we think about where kids typically would get bruises. Well, it's not uncommon for a toddler or preschooler to have a array of bruises in different stages of healing up and down their shins, right? They're mobile, they're running, they're playing, they're jumping. But, if the child has bruises on the arms or the face or the trunk, then we get concerned. I remember working Emerge and having a little 4-year-old girl admitted with severe abdominal pain. She had some abdominal bruising, and she went for ultrasound, and they ended up finding multiple bowel lacerations. So she had probably been punched or kicked or something in the abdomen. So bruises in weird or atypical places. Multiple fractures in various stages of healing. Most kids that come in with suspected abuse, we would do a skeletal survey on them, and that would be x-raying them from top to bottom, looking for old fractures that might have healed. But there is a condition called osteogenic imperfecta. In fact, last year when I was teaching this in Block 2, there was a child with that at the Children's Hospital. So you just always need to know that could be a possibility, but we do screen for other injuries and old fractures, because often they can come along with the current injury. So I remember a 9-month-old baby that got admitted with what looked like shaken baby. And then when we did the skeletal survey, he had old fractures of the humerus. And so it kind of starts to put the picture together. Bluish bruise on the lower sacrum. You've seen Mongolian birth spots maybe in your maternal newborn or learned about them. Sudden infant death syndrome can initially sometimes present like shaken baby. But with shaken baby, we're looking for things like retinal hemorrhages. Those are very common with shaken baby. And there's a few other injuries that are very typical of shaken baby that you wouldn't see in SIDS. Cultural practices, cupping and coining. And what we need to remember is in the Canadian Incident Study, of all the investigations they did, less than 45% were substantiated, proven, there was enough evidence, 22% remained suspected, and 33% remained unsubstantiated. So it's important to know that what looks like it might be child abuse isn't always the case. So our action when abuse is suspected, well, from a nursing perspective, when we look at our code of ethics, we know that we have a moral and ethical obligation to report. And better to report and be wrong and it be unsubstantiated than to not do anything and have the safety of the child in jeopardy. So say you're working as a nurse and you're front lines and you're the first point of contact with a family, with a child where you suspect abuse. So we do not challenge the information given by the parent. Often, so the parent tells you how the injury happened and you're looking at the injury and going, okay, there's no way that this adds up. We never challenge the parent. We always just accept the information that they provide. But we do ask how injuries happen. Can you tell me how these bruises occurred? Can you tell me how Anne broke her arm? We don't like to convey concerns to the caregiver, facial expressions, body language, especially if they're in a position where they might decide to scoop the child and run. So take a medical clinic or the emergency. They're they're not actually admitted to hospital. And, if we convey a lot of concerns, they may just grab the child and run, because both the child and the family are very, very vulnerable at this time. So we really need to use a non-judgmental approach. The role of the healthcare team is not to conduct the investigation. You want to be familiar with policies and procedures wherever you're working. There'll be, probably a written policy around how to deal with suspected abuse. I know when I worked public health, our policy was that if we suspected it, we made a call to Child and Family Services. And I was out visiting a preterm infant, freshly discharged from hospital. And I think about the third visit I saw them, the baby had a bruise on its head. And when I asked how the bruise happened, they said the baby had rolled into the crib rails. Well, 2-month-old babies don't roll. And, it was a very vulnerable family with a lot of high risk factors and living in poverty. And so very, very young parents. So I just went back to my the health office and called Child and Family Services, and they were out within hours, because it was A, an infant, B, a preterm infant. So they responded really quickly to the call. And certainly within the Alberta Children's Hospital, there's a child abuse team on call 24/7. So we would put in the call to them, and those are the experts that would conduct the investigation. The police might be brought in. There might be collection of samples, all kinds of things. What's really important is to document verbatim. And I just had a recent conversation with a nurse about this, who was caring for a child, an infant, admitted that it appeared to be abuse, shaken baby. And she actually was called in by her head nurse following caring for the child, because they really felt that the documentation was not extensive enough, and we need to document verbatim anything, everything the parent says, what we hear, what we observe. Just want to touch on dealing with disclosure. So this can be a stressful experience as a nurse. And it's, when the child actually tells you that they are experiencing violence in the home, or being abused, or experiencing physical abuse, emotional abuse, sexual abuse. And so the more important thing is to allow the child to do most, if not all, of the talking. If you need a little bit more understanding of the context, use very, very open-ended questions, or a phrase such as, "Oh, can you tell me more about that?" You might put your hand on their arm or their shoulder and just ask very broad, open-ended questions. Children don't lie about these things, and if we do press them and interrogate them, often they'll recant, or they'll withdraw their disclosure and say, "Oh, no, that really didn't happen," because they get nervous or scared. So once you have reasonable grounds to suspect abuse and the child discloses, you stop asking any further questions. It's really important that you reassure the child that telling you was the right thing to do, but explain to them that you can't keep it a secret. You believe them, and you're going to have to tell someone who can help them. So reassure that they'll be safe and that you're going to take action on it. So just wrapping up here, prevention of maltreatment. If we go back to our 3 circles, our child risk factors, parent risk factors, and environmental risk factors, we think about then what social or environmental interventions, parent-family interventions, or child interventions could we put in place to decrease the risk or incidence of child maltreatment or abuse. And one of the programs that research has documented, proven is really effective is actually having nurses visit families and children in their home. So there's a program, it used to be called Healthy Families. Now I think it's Healthy Children and Families, so it's got a new name. But it's a program that, as a public health nurse, if you're out in the community, you're seeing new parents, new babies, you can actually assess for risk factors and make a referral to this program. And so, there's been research done broadly in North America that proves that this is actually one of the most effective strategies for reducing the incidence. Another great example would be getting prenatal care to moms who are at high risk. So we have a program here in Calgary called Best Beginnings, where high-risk moms, maybe living in poverty, young, poor coping skills, poorly educated, can receive support throughout a pregnancy and then support post-delivery. So a couple good examples of prevention.